speak just a minute about the situation in Alaska, and sometimes I feel a bit like a broken record in trying to describe why it's so different, why it's so unique. Highest veteran population per capita amongst the states, second lowest population, facilities very, very limited, facilities very dispersed. We don't host a full-service VA hospital, but we do have opportunities that we have created because of other federal systems, whether it's working within the IHS. We've got more patients than providers. We just simply don't have doctors that are taking Medicare-eligible individuals. So as we built out this legislation last year, quite honestly, it was going to be a very, very hard fit for Alaska. Initially, it was going to be that that folks were paid on the Medicare rate, which of course in Alaska is lower than anything else, would have chased everybody away. We got that adjusted, but still we're limited to participation in the choice card program to a Medicare provider. And again, we just don't have the providers to go around. I'm told that central office has reduced Alaska's VA budget for partnerships and purchase care about $78 million now. And because what we have done, what we've built out over the years, are all of these alternatives so our veterans can find some level of services, this is a problem for us. We just simply do not have facilities in these places where our veterans live. For so many years, the veteran was put on a plane to Seattle to fill the gaps. We had some long battles in this committee and others. Secretary Shinseki really stepped up and helped address how we could, again, fill in these gaps of services for our providers. And we work in partnership with our native health system, and by all accounts, this is working for us. The choice card, on the other hand, is untested. The provider needs to be willing to accept the card. Again, we've got more patients than providers, and I'm concerned about where we are. The question, and this is perhaps a little broader than you've had from others, is does the VA have enough flexibility to ensure that Alaska's veterans don't lose the gains that we've fought so hard to put into place? We're moving to the choice card, but are we going to see, almost by default, an erosion of the level of access that we've been able to build up over the years utilizing other federal partners?
I see absolutely no reason why we would see an erosion. You're right that it's early days for the choice program, and we're committed to working with you. First, we are committed to finding any flexibility that we can vis-a-vis the 40-mile rule. There's one.
Well, we're already
yes.
all veterans in Alaska are enrolled in
not relevant
choice,
to Alaska, right? For sure. When you say that there has been a cut in the budget for purchase care, I think that what you're seeing is that as a result of the Choice Act, we have consolidated a lot of the funding for purchase care to our central business office. But that does not necessarily mean that we're buying less purchase care. Thus far, our experience would suggest that that is not the case. And in fact, in the middle of our access crisis, when things were, I felt like particularly acute, what I learned was that some of the facilities in Alaska are very, very good at the coordination that goes on there because they've had to be, and that's terrific. We're also have spent to date about $10 million on partnerships with the Indian Health and Tribal Services. And I couldn't close this without acknowledging that Alaska has long been a source of inspiration for us because of the NUCA Clinic, which has won so many awards and really has inspired many of our efforts in primary care. So,
when I appreciate that, and I encourage you all, remember that we've had to think outside the box. We've had to be creative, and we have done it to relative success. So again, we would hate to see any erosions. Very quickly in my remaining time, and this goes to Senator Tester's issue about recruitment. In many cases, the issue for us with VA care in Alaska has not been the wait to see a VA provider, but it's been this extraordinarily heavy caseload that our providers have, particularly in our CBOCs. And you've all heard the example of the CBOC there in Wasilla. You had a physician begging for help, and they couldn't provide anybody to her. She eventually leaves. VA has continues to make the excuse that we just can't get providers to Wasilla. This is a community, this is the second largest community in the state now. It's on the road system. IHS seems to be able to recruit for places like Barrow, Kotzebue, Nome, all off the road system. I can't figure out what the problem is here. And I would like to know, Dr. Clancy, that you are looking at this, you're evaluating, you're trying to figure out what it is that we're doing, because just an interim fix isn't addressing the needs of our veterans out there.
No, I hear you. And I would say that recruiting and retention is probably our biggest number one challenge, particularly for some areas that are not well served. I did speak with your colleague, Senator Tester, yesterday, wondering if we might actually figure out working with the University of Washington, since it reaches out to those 4 states, including Alaska and Montana, to try to figure out, can we get more students into rotations that would have a focus on VA? So that's on my list of opportunities to explore, but I hear you.